Well, welcome back to the Natural ADHD Solutions Summit. And for our next guest, we have Cilla Whatcott with us. And she is going to share with us some really cool stuff that I'm excited to learn about and to share with you guys. And so I'm going to let her tell us a little bit about who she is and her background and what she's doing these days. So why don't you go ahead and do that, Cilla?
Thanks, Dr. Brad. So I'm a classical homeopath, and I have certification in classical homeopathy and a PhD also in clinical homeopathy. My own children brought me to the field. They suffered from kidney reflux, ADHD, migraines, asthma, and I was very enthusiastic about bringing them to specialists to try and find solutions, and couldn't from the medical field at all. So I ran into a lovely pediatrician who was very open-minded and said, you should try homeopathy for asthma, actually. And this was over 20 years ago. So I found a homeopath. I did some reading. My son's asthma was gone within 6 months. Migraines gone, kidney reflux gone. So many amazing changes that I decided to go back to school for homeopathy. So we relocated. I spent 4 years in homeopathic medical school, loved it, felt like I was completely home, and have never looked back, never gave my children another antibiotic since going to school, and have really found my calling in life. So that's the short story of what brought me here, and I've been practicing now since around 2003, full-time as a homeopath, teaching, seeing patients, making a couple of films, teaching classes to professionals, the whole gamut.
Yeah, excellent. So, yeah, I mean, it really obviously hits home when you see the changes with your own kids, and can definitely shift perspective. So, why don't you tell us? Certainly, there's some people who are watching who are somewhat familiar with homeopathy, but I imagine quite a few people who maybe have heard of it, but maybe don't understand how it works or what the deal is with it. So, maybe you could give us kind of the basics to start with.
Right. So a lot of people confuse homeopathy with herbal medicine, naturopathy, supplementation, essential oils, even, and all of those things are separate categories. Homeopathy is a full system of medicine that only uses homeopathic remedies. And homeopathic remedies are made from a dilution and succussion process, meaning we start with a source substance. It's diluted serially again and again and again and shaken until there are no molecules of the original substance. So we've rendered it completely a energetic medicine. We have a frequency. And from that, it's anointed onto sugar pellets. And sugar pellets are put in the mouth, so it's very easy to administer. And that energy triggers the vital force to do the healing. So it's not like a medication that stops a process or adds anything to a process. It completely encourages your own immune system to do the healing, which is the amazing part. So there's no side effects. There's no injuries. There's no more likelihood of an injury with homeopathy than there is with music or prayer or any of these energetic modalities. So I love that it's so safe. We're using things from nature, animal, mineral, or vegetable substances, and it's highly individualized to the person. So we can have 10 kids with an ADHD diagnosis, and they'll get 10 different remedies because it's based on their particular symptoms, what's limiting to them, what are their likes, their dislikes, their tendencies. All of that is gathered in an initial intake, analyzed, and then matched to one thing in nature that would cause those symptoms. So this is the principle of like treating like, which homeopathy is based upon.
Gotcha. That makes some sense because I know, well, I have a couple questions that come to mind. So, because, at health food stores or natural grocers, there's often, a display of I see the little tubes often of
Yeah.
homeopathic remedies. And so you're saying, it's very individual. And I see ones that are like, this is for back pain, And
Right.
so is that something different or what's the distinction there?
So what you're seeing at the store, it's a lot more of a practical application. So lay people can very easily go to the store if they have bruising, they can use arnica. If they have other conditions, they can look on the label and apply it. It may very well work instantly, but that's very practical. Classical homeopathy goes a lot deeper. We take an entire case and then choose one remedy that's going to match all the aspects of that case, and we're going to give it in a much higher potency. So the 30C potency is the most common one you see at the store, and that's a dilution of 1 to 130 times. Okay, so homeopaths, professional homeopaths, will use much higher dilutions, maybe 200C, maybe 1M. And these things are a higher frequency, much more refined. They go deeper into the system. And this is something that you wouldn't dabble with at home. You would need a professional homeopath. But again, for minor things, you could easily go to the store and choose one of those low potencies and apply it
Gotcha.
without any risk whatsoever. Either it's going to work great or it won't work at all.
Uh-huh. And if it doesn't work, then it's just like you did nothing.
You didn't hit the target.
Uh-huh.
So
Right.
you have to be sure of the target, basically.
Gotcha. And so you're saying the higher potency is actually more diluted. Is that's am I understanding
Correct.
correctly? Yeah.
It's hard to wrap your mind around.
Yeah.
It's more dilute, making it a higher frequency, more refined.
Mm-hmm.
So,
Interesting.
yeah,
yeah, go ahead.
well, we all operate at a certain frequency. You know, you hear the term, I really resonate with that. Or, you know, we're made up of cells that are vibrating at a certain frequency. And some things are more amenable to us and more familiar to us because they're matching our frequency. And the world is made of energy. Many Nobel Prize winners have made that statement. The world really is energy. So homeopathy is an energetic form of medicine. And it's about finding the right frequency to match your pathology. So if you come to me, Dr. Brad, with a bee sting, and let's say you have hot, red, swollen place from a bee sting, painful, I might give you Apis mellifica, which is bee venom, that's been diluted and potentized. There's no bee venom in it, but it has the frequency of bee venom. You take that, immediately your vital force recognizes that frequency, and it's like a tuning fork, and it will adjust itself back to your human frequency, reduce the swelling, reduce the pain. And I've literally had cases where someone mowing the lawn ran into a hive, multiple stings, they're blowing up. We give them Apis. Within 10 minutes, everything's coming down. So it's amazing when it works, when you've hit the target, it's quite amazing how quickly it can work.
Wow. So then is the sort of the idea behind how that's happening, that when you have the actual stings before you take the homeopathic remedy, that your body's reacting, but maybe it's kind of like I can't think of what the word is, but like out of frequency with itself, like it's sort of like not in full communication frequency wise.
It's going into the frequency of bee venom because you've been stung by a bee, so it's going into that other frequency and responding with inflammation, pain, redness, all of those things. Our symptoms are simply our vital force speaking. So whether you have arthritis or a bee sting or a headache, your vital force is expressing itself. And as a homeopath, we're trained to read those expressions and interpret them and understand what in nature would cause this picture. And that's what I'm going to match to your case.
And then what's the shift that then happens when you do take the homeopathic remedy? Like, how does that work?
Yeah. It depends on the intensity of the pathology. So for the bee stings, which are very intense, very acute, very sudden, we can see an instantaneous improvement. Absolutely. For more chronic conditions that are long-standing, you're going to see a slower improvement. So you're going to see gradual changes. Let's say you have chronic headaches. And at our initial intake, I'm going to find out how often do you have the headaches, how long do they last, and what's the number on the pain scale. Okay, so frequency, duration, intensity. And I'm going to notate that. I'm going to give you a constitutional remedy. You're going to come back in 4 weeks, about 4 weeks, give or take. And most people will come back and say, I still have headaches. And I'll say, okay, let's take a look at this. How frequently are you having them? And I look at that number. How long do they last? What's the number on the pain scale? And lo and behold, we find that all those numbers have come down. So you are on a trajectory of healing that your body is orchestrating. So it's not like taking an aspirin and getting rid of a headache instantaneously. Your body is making the change. So I'm seeing this trajectory moving in the proper direction, and we're going to redose that same remedy or tweak the dosage somehow, and you're going to come back in 4 more weeks. And after a few months, you're going to say, you know what? I haven't had a headache in weeks. And that's healing. So it's very different than the suppressive model of Western medicine that gives you a medication just to suppress the symptom.
Yeah,
it's your body really,
opposite.
yeah, and it's healing because then you don't have headaches anymore.
And so at that point, in this headache example, then you're done taking the remedy?
You're done. And let's say down the road, you move or you change jobs or you have a relationship trauma of some sort. So you're under stress, emotional, physical, any kind of stress. You start to get a headache. So you go back to your remedy and you take a dose of your remedy and boom, it takes care of your headache. So intermittently through your life, you may need a dose of that same remedy, or perhaps you'll need a different remedy. So you try your same remedy, you see if it works. If it doesn't, you go back to your homeopath, you do a little more digging, find out what the state is, the inner state, the imbalance, and maybe you get a different remedy at that time. But it's something that you would return to intermittently as needed. And typically people need something when another stressor comes up, because that's what throws your body into a compensation state where you're expressing a symptom, you're trying to balance yourself, and the body does that through symptoms.
Mm-hmm. Mm-hmm. Yeah, fascinating. So then my other question when you were telling your story is, from the place you were in, happy to take them to all the medical specialists, and then being directed to a homeopath, and then being given essentially little sugar pills if you don't know what it is about. How did that strike you? I mean, what was your experience with that? Were you just at the point of like willing to try anything, or were you skeptical, or what happened with that for you?
I'm a very intuitive person, and I kind of go by my gut, and I had a feeling about it and I wanted to explore it. And I'm an intensely curious person, which is what makes me a good homeopath. So before judging, I'm curious to find out more. And that's what I did with homeopathy. I was just curious. And when I found out more, it struck me as this is interesting. And it wasn't that long before I saw results.
Right.
So my daughter with kidney reflux, she was having repeated kidney infections with high fevers and pain. She was 3 years old. Oh. And we gave her first constitutional remedy. Shortly thereafter, she started getting a kidney infection. I called the homeopath. She told me what to give her. Within 20 minutes, her fever came down to normal and the pain stopped. Wow. And that really grabbed my attention. And after that, every time she felt like she was getting a kidney infection, we'd give her a dose and it would abate. And she never had another full-blown kidney infection.
Wow.
So it was so instantaneous, there wasn't time for me to be a skeptic.
Yeah.
I saw it work right away. And in some cases take a little longer. I usually tell people, give the process 6 months, you'll see changes.
Yeah.
But frequently they see changes with the first remedy. I've had many cases where one remedy and they're blown away because it works.
And I guess that's the bottom line, right? Whether you understand what's happening or not, the
if
results.
It works.
Yeah.
Yeah.
Absolutely.
Yeah. I've never looked back. Absolutely.
Yeah. So let's talk, we've used some examples of bee sting and headaches. So let's talk specifically about ADHD. As we all know, who are familiar with the world of ADHD, that many kids have different symptoms that all sort of get labeled under the one label. Right. Some kids are hyperactive, some kids aren't, but they have trouble paying attention. There's a whole bunch of different things. How does homeopathy play into that if somebody wants to explore that for helping their kid function better?
Right. So again, I could have 10 cases that are diagnosed with ADHD. They're going to be on 10 different remedies completely. The most important thing is unbiased observation. in the process of analysis. Now, by that, I mean that if a parent comes in and says, the school says he has ADHD, okay, that's a word, that's a label. I need to know what that looks like. Is he having meltdowns? Is he attacking kids? Is he talking incessantly? Is he jumping up and running out of the room? Um, I could go on all day with the different symptoms that might be possible. That's what I'm interested in, not the label. So it's really important for parents to hone their observation skills and to be able to say to me, this is what is happening. This is what's limiting my child. Without any judgment, because frequently parents will say, well, he's really a nice kid, but sometimes he doesn't listen. Well, we all know he's a nice kid, the real him. What we want to know, what's the pathology? What's the behavior that's getting him hung up so he can't be a nice kid all the time? So just honestly tell me, he has meltdowns, he bites, he screams, he has night terrors. What is happening in real time with the child? That's what I need to know. The best thing a parent can do is hone their observation skills so they can report that very, very accurately. And then we have a starting point. So once we give the remedy, they'll be able to say, this have changed. And we'll know that. Instead of just saying, oh, the teachers are still complaining. I need to know what they're complaining about. And the other thing is, there can be a big education piece with the parents because many kids have different learning styles. Some kids are brilliant with kinesthetic learning, and they'd rather be playing outside, or they're going to be an athlete, and that's, I hate to see kids get pigeonholed because perhaps they could learn brilliantly if you just instituted some methods to let them learn kinesthetically instead of expecting them to fit into a box with every other kid. So is it a problem with the kid or is it a problem with the system? And that's something that I've become very discerning about and can help parents just take a look at that. I mean, nobody's making any judgments about anything. Let's just get the information and let's understand the case. That's what's most important.
Gotcha. So observing without the judgment, really, and looking at to whatever degree of discernment is possible. It's not just they're not paying attention, but what's happening when they're not paying attention, or what things are they not paying attention to, and that get down to the detail level. And so then, what I think of also is, so if this is something a parent wants to explore, is it the kind of thing that, well, okay, let me rephrase it. For some people that I've talked to and worked with, they're maybe in a remote location, or they don't know if there's a homeopath practitioner nearby. Are there things that they can do without that, or are we really talking about that to really get to the heart of the matter? It's required to have somebody with that expertise.
I think that treating ADHD on your own without a professional would be very difficult because we're looking at classical homeopathy, which takes many years to master. So there are different combination remedies that may be advertised for ADHD. It's a shot in the dark, Brad, but I mean, it could be tried. And I know people who have tried these combination remedies that something in that remedy hit the target and they saw good results. So it's a cheap and easy way to give it a try. It is not the best way to really analyze and prescribe per case. So they would need a skilled homeopath. Some, myself included, work remotely through Skype or Zoom. And that depends on the child's willingness to interact. If the child is not comfortable talking to somebody on a screen, that could impair the progress in a case like that.
Mm-hmm. Yeah, that's what I was going to ask. It definitely seems like something, just based on your description so far, that would lend itself fairly well to, whatever we call this, telemedicine or
telemedicine.
Internet help.
A lot of the case I'm going to get from the parent. What I need from the child is the energy. I need to get a feel for how that child operates in the world and a little bit about what goes on in their mind. What do they like to play with? Do they have dreams at night? Do you have scary dreams? What makes you mad? What makes you happy? When you play with your friends, what do you like to play? Who makes up the games? Is it you or is it your friends? I mean, there are many things I can ask the child if they're open to answering. And then I get a lot of the case from the parent because the parent can give me the details and the chronology. When did this start? Is there something that precipitated these behaviors? Lots of information. And in taking a case, I literally go back to pregnancy and take the mother's pregnancy, labor, delivery, infancy, all the way up to present time. So I have a good understanding of the timeline.
Gotcha. So, gosh, everything you're sharing is so full of different things. It's like my mind goes in multiple directions. But I did want to make sure we touch on, you and I connected a while ago for the Kids Eating Broccoli podcast. And in there, you shared a lot about the work you were doing with homeoprophylaxis. And so I want to make sure that we touch on that today as well, because I think that though maybe it's not as sort of universal necessarily, but I definitely run into a lot of parents who wonder if, traditional or Western medicine vaccinations had a part to play in what they see going on with their kids symptomatically. We definitely hear about that more sort of in the public with autism, but I definitely hear a lot of parents talk about that with ADHD or other chronic illnesses, either from the perspective of like, oh no, what did I do? Or I've heard about this and my kids are due for the next round. And what do I do about that? And so I'd love for you to just tell us a little bit about that, if you would.
Right. Big topic. Let me think of how to take it a bite at a time. Many parents are questioning. Many parents have access to lots of very good information with studies, with social media. So the information is out there. Many parents choose not to vaccinate. And the good news is you don't have to vaccinate. You can use something called homeoprophylaxis. It's been around for 200 years, completely safe, never been a death from homeoprophylaxis. It's used in many countries, more so than the U.S. In India, it's actually endorsed by the government and passed out free of charge during epidemics. Great studies out of Cuba with millions of people protecting against tropical disease. So parents do have an option. There is a choice, and they can use homeoprophylaxis. So I'm working on a series of films. The first film is called The Quest for Real Immunity, and it's more philosophical, and it basically talks to parents about why you don't need to be afraid of fevers or childhood disease, how you can trust your intuition, and by accessing that intuition, you will be empowered to make good choices for your child. So get out of the fear, move the fear aside. The second, and that was launched back in February of this year. In November, I'll be launching Passage to Real Immunity, and it highlights homeoprophylaxis, or HP, we call it for short. And I've interviewed researchers, doctors using it in India, Australia, Europe. I've interviewed parents using it to really give viewers a bird's eye view of what's behind it, how it's used, what people think about it. And that film will be released in November. And you can see more information on realimmunity.org. So that's the website for that. And what I offer is an entire program. So I feel very strongly about education, and I will not just sell a kit or a product. What I sell is an education. So the program consists of a kit with 8 diseases to protect from 8 diseases, a one-on-one training session with a parent that lasts about 45 minutes, a booklet for record keeping, and email support within the program for the duration of the program. So all of that encompasses a program for parents, and it's based upon a 15-year study with these 8 diseases that was done out of Australia by a doctor in Australia. So all that information is available on realimmunity.org.
Excellent. So definitely offering the reality that there's another option beyond. I mean, I think a lot of people realize that maybe there's a choice to vaccinate or not, but that there's actually a third option that you're
Exactly.
presenting here, that using homeopathy can impart those protections for our kids if we're worried about them
Exactly.
getting these illnesses,
Right.
but without the the
Risks.
yeah the
Yeah.
significant
And
risks of the other.
also, what needs to be in place prior to making a choice is relinquishing that fear. Because a fear driven decision is never a conscious decision. So that was my motivation in making the quest for real immunity, just helping to dispel that fear and giving people solid information from thought leaders. I mean, Dr. Paul Thomas on the West Coast, Tetiana Obukanich, the immunologist. I mean, these are respected people in their fields, and they're letting us know that we don't need to be so afraid. And I think that's the first step. The next step is trusting yourself. I can make a good decision. I can get the facts. I can check in with myself intuitively as well as intellectually, and I can make a decision because the bottom line is nobody cares about your child like you do. So you're only going to make a decision with what you know for their best interest. And that makes you an expert. So that qualifies you to make a decision. And I
Yeah.
think those steps are super important. And I want parents to have those steps before they launch into homeoprophylaxis. I don't want them to think about it just as a substitute. I'm going to swap out vaccines for this. Give me the kit. Let me do it. I don't want that. I really want them to feel empowered and to learn.
Yeah, that's wonderful, because I mean that's something you obviously can take with you your entire life beyond just the early childhood vaccines or
Right.
homeoprophylaxis or whatever direction you decide. Um, and then I know when we spoke before with the kids eating broccoli, and I actually have heard more about it, but I know there's also an option. Homeopathy provides an option for parents who originally went down the Western route, with the vaccines, and then are concerned or even know that it caused injury
Right.
for their kids and are wanting to do what they can now about it.
Right.
Can you share with that with us a little?
Sure. So classical homeopathy itself can work wonders for reversing, mitigating vaccine damage, depending on when it happened in the timeline. I've worked with kids that parents saw something immediately and we started working right away. I've worked with kids that 15 years in the past, the damage happened. So all of those variables affect effectiveness and application, how we're going to work. Classical homeopathy itself is the first thing I always come in with. If we hit an obstacle to cure or a roadblock where we're not seeing any progress, we look at something called cease therapy, CEASE. People can find information on cease-therapy.com. And cease therapy was designed to uh, detoxify people from anything that's creating pathology. It can be antibiotics, it can be pesticides, it can be vaccines, anything the system can't clear. And cease therapy is very effective. It's not overnight. It can take a little bit of time, but it's very gentle. It can't cause damage. At the bottom line, it's much cheaper than a lot of modalities because you're not purchasing tons of supplements, or you see a practitioner once a month. After that initial intake, that's the lion's share of your cost, and after that, it's very economical. So a lot of parents like cease therapy.
Uh-huh. Yeah, that's great. Because I think that we're often left with, in sort of the mainstream world, for lack of a better term, that that they might have been damaged or injured by vaccines, and sorry, too bad. And to know
Right.
that there are options that can really help turn things around, even no matter where you're jumping into the waking up to what might have
Right.
happened.
So what I see a lot in my practice is dysregulation of the immune system. So when you take a 2-month-old child and give them 8 diseases all at once in the form of vaccinations at their well child check, the system becomes confused because nature doesn't deliver disease 8 at a time. So in its confusion, it will try to detoxify and it will become inflamed and it will throw up a response of maybe ear infections, maybe a cough, maybe diarrhea, something that is inflammatory and trying to expel the toxins. So a new parent may take that child back to the pediatrician. The pediatrician makes no connection to the vaccines whatsoever, gives an antibiotic, and suppresses that discharge process. So the child's now suppressed, and it's still trying to get it out. And then the doctor may say, well, it's about time for the next round of vaccines. Let's just give them the next vaccines while they're here. So now you've added more toxicity into the system, and you've set up this chronic process of trying, like a car with its tires stuck in the snow, spinning, 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 spinning. It can't get any traction. So now the child has chronic sinusitis or chronic otitis or asthma symptoms because they're creating an inflammation and trying to discharge something, and they can't do it. So I get a lot of kids in that camp. And the goal with classical homeopathy in that situation is simply to reteach the immune system what it already knows. I'm just reminding the immune system. So we support it with homeopathic remedies to move through this infection, the chronic infection when it comes up, follow them very closely, and they're able to get traction with the tires, come up and over that response, come back to baseline, and slowly the system remembers what it knows how to do effectively. And many children have gotten past their chronic infections with homeopathy in that regard.
Gotcha. Yeah, I think it's important to understand the shift of thinking almost in that.
Huge.
Because it's not like you have some necessarily just some toxin that's stuck in your body and we're going to give you something to pull it out, as much as your body knows what to do, but something is out of sync. And so what we're helping it do is get back in sync so that it can
Remind
do what
it
does. Yeah.
Yeah. Exactly, because as human beings, we have this miraculous ability to regenerate. That's our goal, to move towards perfection and health and wellness, especially children that are so vibrant. So it's very doable, but it's a huge shift in thinking, as you mentioned. And honestly, after going to homeopathy school, I've never thought the same way about health at all. It's a miraculous shift that's much more realistic.
Yeah.
So,
I feel very similar about chiropractic school in my experience
yes.
with that. So yeah, I feel like what do you call it? Sibling professions there in terms of that
I
perspective.
think so.
Yeah.
Very much. And chiropractors are the ones that get it the most, and especially with homeoprophylaxis and chiropractic is a fabulous modality to use with homeopathy. Mm-hmm. Like some people will say, can I still go to my chiropractor? Or can I still take my supplements? And the answer is yes. I mean, chiropractic, psychotherapy, supplementation, all of these things can just help, because if you have the organism functioning at its optimal level, homeopathy can work better.
Mm-hmm.
So
makes total sense. Yeah, excellent. So I feel like we could probably go on and on all day. Your wealth of information and knowledge about this. So I really appreciate that. I know you prepared something to offer to our audience as a free resource. Can you tell us what that is and a little bit about it?
Yeah, it's the Health Helix. So I sent you the PDF. I'm not quite sure how to deliver this, but it's
we'll
basically...
put a link below this video that people will be able to access it. Yeah.
Yeah, the Health Helix just shows you, it's a diagram that shows how your energy, your vital force, expands and grows when you support it with natural methods such as chiropractic, homeopathy, etc. And what happens to it if you suppress it? If you continually suppress symptoms, you go into deeper pathology. And it's a visual graphic that shows you how this works. So a lot of people really resonate with it, and they can get it when they see it in color.
Sure. Yeah, that's great. That sounds wonderful. And then I imagine that, that a lot of people are wondering, like, okay, so this sounds great. I want to give this a try with my children. And so is there, what do they do if there isn't obviously, somebody nearby? Is there a database? Is there some resource? Should they reach out to you? How would someone go about that?
Sure. People can reach out to me. If they're interested in homeoprophylaxis, they should go to realimmunity.org. And there's a tab on there for homeoprophylaxis. If they're interested in constitutional care, just general care, they can go to familyhomeopathycare.com, familyhomeopathycare.com, and they
Okay.
can see my services there.
Excellent.
So,
Excellent. And then as far as just continuing with the education piece, you mentioned the films, the one that released in February and the one that's coming up. And why don't you just tell us again the website for that?
right. So to access the films, realimmunity.org,
Okay.
and you can stream Quest for Real Immunity. You can purchase the hard DVD. You can see a little bit of information about Passage to Real Immunity coming out in November. And I'm working on a premiere at a location that's undisclosed right now.
Gotcha.
In November, and I'll have that on the site once that gets nailed down.
Excellent. Excellent. Well, I thank you so much for being part of our summit and just sharing with our audience. I think that it's a wonderful resource to have for people to have their, to understand more about homeopathy, to see it as something that's a viable option to really help. I mean, certainly their children, have a better functioning body, better functioning mind in life, and for themselves, and anything that may come up in their health and in their life. So thank you so much for joining us and sharing some of your wisdom with us today.
Thanks so much for having me, Dr. Brad. I appreciate it.
All right. You take care.